Let's look exactly at what happens in your shoulder when you start feeling shoulder pain. For the purpose in this book, the program that you will learn is going to focus on minimizing the impingement motion that occurs in your shoulder joint that could be causing your pain. As stated already, the function of your rotator cuff muscles is to primarily stabilize your humerus head, the top portion of your arm bone, when you move your arm in different directions. The rotator cuff basically pulls the head of the humerus in towards the socket joint, also known as your glenoid labrum, and to keep it nice and tight in the joint space to minimize any excessive movement. What occurs with a rotator cuff tear or a rotator cuff injury is that the rotator cuff loses this ability to keep the humerus head centered and stabilized, and in many cases, due to an injury or due to muscle imbalances where specific muscles get weak, for example your back muscles, shoulder blade muscles, and tight muscles such as your chest muscles, will cause the humerus head to glide up towards the acromion, which is the top portion of the shoulder blade, pinching the rotator cuff as well as the bursa between the humerus head and the acromion. The bursa is a gel-like structure that serves as a shock absorber in the shoulder joint, and as you can see in the picture, when this area gets pinched, it can also get inflamed and can lead to a condition such as bursitis. When this impingement movement occurs on a repetitive basis, what happens over time is that in a already very small joint space, you start developing swelling and the rotator cuff tendon becomes irritated. If this condition is not addressed by improving your posture, improving your muscle balance around your shoulder joint, and reducing this chronic state of irritation, you can get a rotator cuff tear where the humerus head physically, due to changes such as bony changes, pinching it against the acromion, can start fraying and causing a rotator cuff tear because of the bone-on-bone contact. Over time, as I've already mentioned, not only will you sustain a rotator cuff tear, but scar tissue and inflammation will start building up inside the space between the rotator cuff tendon and the acromion in that small joint space, and it will lead to a restriction in your movement and ultimately can cause conditions such as adhesive capsulitis or a frozen shoulder, as well as permanent damage where you can lose your ability to fully raise your arm up above your head or even handle any activity such as raising your arm with any form of weight. The ultimate damage that will occur if this is not addressed is osteoarthritis of the joint as well as the humerus head. And I've included some pictures for you to see what that looks like on an x-ray. And this condition combined with a rotator cuff tear long term will lead to the need for a shoulder replacement, which is something you need to avoid at all cost. So by being proactive and addressing this, you can avoid surgery and hopefully a rotator cuff tear long term. There are specific exercises that will increase the irritation in your shoulder and increase the incidence of impingement. Here are just a short list of exercises that you should avoid. Push-ups, overhead reaching like lat pull-downs, any overhead activity while you're feeling your symptoms, and weights with increased leverage that could cause rotator cuff strain. The reason why I do not like push-ups when you're dealing with a shoulder that's irritated is that it increases the strength of your chest muscles, which in turn will pull the humerus head out of proper alignment in the joint as you move it back and forth, and this could lead to increased impingement and ultimately a rotator cuff tear in your shoulder.